Welcome to Webisode 18 on special dosing orders for tapers. I'm Lisa Wheeler. I'm a physician assistant with over 25 years of experience in several specialty areas, including orthopedic and emergency trauma medicine. For the last 6 years, I've been practicing in the areas of addiction medicine at an OTP, as well as OBOT and pain management in a private practice setting. In opioid treatment programs, we sometimes get requests from patients to taper off their medication more rapidly than we would recommend. There are no clear recommendations for tapers, and tapering can be a complex issue. It must be patient-centered and not cookie-cutter. I approach tapers with slow and steady wins the race. First, the patient's current dose is taken into consideration. Individuals on higher levels of methadone may be able to decrease at a larger milligram amount than individuals on lower doses. Globally, I usually recommend 1 milligram a week. For individuals that are on large doses, such as 200 milligrams a day, I may decrease by 2 milligrams a week. Throughout a taper, I will decrease to a certain point and then see the patient back for reassessment. I always write in my order that the patient may hold their dose at any time, and if they want to restart a taper, they must see one of the medical providers. If they are needing to go up on dose due to withdrawal, they must be evaluated by a provider. For buprenorphine, the theme of slow and steady usually wins the race is also as important. I usually taper buprenorphine by 2 milligrams a month. I always write in my order that the patient may hold their dose at any time, and if they want to restart a taper, they must see one of the medical providers. If they are needing to go back up on dose due to withdrawal, they must be evaluated by a provider. Ultimately, a voluntary taper is negotiable and based on dose and patient stability. It is very important to educate the patient in the process of a voluntary taper and why we so strongly urge a slow titration downward. Sometimes patients will want to do a voluntary taper at a faster rate. They get a date fixed in their head, for example. For me, it's important to try and have some understanding of what's going on for that individual. Is there family pressure? Do we need to bring the family in and have an educational visit? Is it because of finances? Is it because of a move, a job, a date with incarceration? The patient should be thoroughly educated on the risks of a voluntary taper that is too fast, which include withdrawal symptoms and possible relapse. Sometimes suggesting a transfer instead of a full taper when someone is moving out of town is helpful. Moving is a very stressful life event and is probably not the time to go through methadone withdrawal. It is important to know the last day the patient will be dosing at your practice. That date is an important tool in determining a taper schedule. You can calculate the number of days left at the clinic and divide that into the patient's dose amount and come up with daily milligram decrease. Hopefully, the number of days is really large and you end up with a number less than 1, so you can go down a milligram every 2 to 7 days. Tapers for financial reasons are usually 10% a day unless there's a good reason to do a slower percentage. Once the patient's finances are restored, they may go back up on dose the same way they came down. Therapeutic tapers are done to assist a patient with program compliance, like adding additional counseling, intensive outpatient programming, otherwise known as IOP, or inpatient treatment. The taper may vary from patient to patient. It could be a milligram a week or day, depending on the risk and the need for additional treatment. This type of taper is typically used after patients fail contracts and are discussed in treatment team and with the patient. If a patient is moving into a therapeutic taper, we will try and transfer them if that is an option. They may do better at another OTP. It is possible that another clinic would be a better fit for that person. Administrative tapers can also be used for things such as vague threats of violence or other reasons based on safety. These two are discussed in treatment team. These actions may be immediate with no taper if possible, or generally a 7 to 10 day taper. Lastly, please remember to check pregnancy tests on females of childbearing age prior to the implementation of any taper, since pregnancy would likely change your decisions. If you have further questions, please feel free to contact your state opioid treatment authority. Thank you for watching, and keep up the good work.